A nurse who worked to save COVID patients is now a patient herself, not with coronavirus, but with another life-threatening illness. Jamie Perez shares her story dealing with something the nurse never expected.
We would have to, gown up in full PPE, N95 masks, gowns, gloves.
Helping take care of COVID patients is something Jamara Hopkins anticipated doing in her line of work.
It was a little unnerving. We're, constantly in this full PPE and it's hot. You can't take your mask off.
As a CNA at St. Mary's Care Center in Madison, Hopkins was happy to help out in the COVID unit as needed. But little did she know that she would walk into that unit for the last time in July after finding out she had stage 2 breast cancer.
It was more of a struggle than the regular struggle, I'll say.
Every 2 weeks, Hopkins goes in for chemo and radiation.
My chemo week, I just can't, I can't come to work because I'm too nauseous and sick, or I'm extremely fatigued.
Hopkins was once getting paid to work 85 to 100 hours per pay period, which helped support her 2 kids. Now, at fewer than 64 hours per pay period, she's fallen about a month behind on her bills, and the medical costs keep adding up.
It impacted, financially, it impacted me a little mentally because I'm, trying to figure out how do I go about, continue to provide when I'm not at full capacity.
As someone who is used to helping others, Hopkins is now the one asking for help, something she said she's never had to do.
This is something I never thought would happen in my life.
Despite the added hardships she faces, Hopkins has found a way to keep her head up while she waits to see if the chemo is working.
Really keep my faith and keep positive.
In Madison, I'm Jamie Perez, News 3 Now.
Hopkins said she still has a long way to go before she can return to work full-time. There's a GoFundMe page set up for her if you'd like to help. There's a link to that on our website, channel3000.com.